So I've been an emergency physician here for 20 years when we've never had an acute response, emergency response with casualties involved, also with injured people involved. And I know there have been around New Zealand, obviously Christchurch is a prime example, but we haven't had any at Middlemore Hospital.
When someone first told me about it, I thought they were joking. And then when I realised they weren't joking, my next response was great denial, is surely nobody would be walking around on an active volcano. And then it slowly dawned, actually, this was very real. And the difficulty that we had was I knew that we would need to gear up, but we didn't know what we needed to gear up for. And we were already running late with the patients that we already had.
The adrenaline kicked in and we sort of went into automatic pilot, and we did what we would normally do, and I went to obviously to inform people that I knew needed to know, our on-call burn nurse, and then I went to go and find the head of ICU, and then the two of us went up to Middlemore Central together to try and find more information. So it really, the adrenaline kicked in pretty quickly, and you just go into what you need to do. Usually patients come to us one at a time, and it's a fairly planned event. The difference for us on this day was, first of all, we didn't know how many patients there were, we didn't know how severely they were burnt, and we also didn't know which hospital they were going to go to. So it was very different on many levels.
We were running between 150 and 200%. The team and I had been up all night the week before, caring for these patients that we were worried about, and then suddenly we get essentially a year's worth of work in one day. And it's not just for one day. We already could predict that we were going to be busy now for the next 3 months.
I think the worst moment for me was probably just realising that there were 31 very sick patients and some of them needed to be sorted out quickly. So very early on, and thinking, well, we can't bring them all to Middlemore, so what are we going to do? Once we sort of had the plan and had discussed with the Ministry of Health that we would repatriate some of them, then we started to go, oh, well, maybe we will be able to manage this in New Zealand at our burns units.
Early on we had burn surgeons coming from Australia, and then as the patients moved into the rehabilitation phase, we had support from physios and occupational therapists from Australia come to support us. But as well as that, we needed assistance to help repatriate patients to international countries, and those relationships that we have with burn colleagues around the world were really useful in terms of us getting patients back to the right place at the right time.
So we had a lot of support both from within the hospital, but we also had international support, and it was great having these other people come. And it was also very interesting watching how they would do things subtly differently. And we learnt a lot from them, but also, it's hard to believe, but they learnt a lot from us too. And a lot of their preconceptions about how they care for a burn patient, I now know they've actually gone back, because they were saying various things that we were doing was, you can't do that because that's impossible. And so actually, with them having come and seen how we do things, they've taken away some of the way we do things to improve the care for their burn patients in other countries as well.
It was very hard work, and I think particularly for the surgeons involved, the 24-hour work was very hard work. But I think we tried to ensure that we had some rostering off, and we tried to ensure that there was some support with each other across the clinical teams and across the IMT, but across the clinical teams, just to sort of tag in and out in order to ensure that the patients were looked after in the most effective way.
The work that we'd done in preparing for mass casualty disasters was really useful. We'd practiced scenarios, we had practiced communication, we'd already identified some of the gaps in the system and created solutions for those. So we learnt that really you need to continue to practice, you need to develop your communication, and that relationships are the key in these scenarios, and that we really relied on our friends and our colleagues around the country to support us through this event.
When you choose to come here to work, this is your family. We actually spend more of our lives here awake than anywhere else. And the support you get, you really know your family when they help you. And things like my colleagues who, normally it's hard to get someone into the operating room, that was not hard. Normally, anything if I want to change a position or get something, it's difficult. It was not difficult. Normally, it's a problem if I run late because time didn't matter. Everyone was on exactly the same mission, and that was to deliver the very best care that we could for those people. And an even greater mission, which was we wouldn't compromise the care of anyone else, and perhaps the toughest one of all, which was to support one another.